Good afternoon, everyone. My name is Olivia Hensey from the New England QIN-QIO, and I'll be your moderator for today's Quality Payment Program March webinar, an introduction to the AMA Payment Model Evaluator. The Quality Innovation Network, Quality Improvement Organization, works with healthcare providers, stakeholders, and communities across New England on data-driven quality initiatives to improve patient safety, engage patients and families, and improve clinical care at the community level. Thank you for joining us for today's webinar. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and we'll take questions at the end of the presentation, and I'll provide you instructions on how you can ask a question over the phone or pose the question in the chat box. So now I'd like to pass it over to Jen Gordon, Senior Project Lead with the New England QIN-QIO, and she will introduce our speaker. Jen, the floor is all yours.
Thank you, Olivia. Good afternoon, everybody. I am taking great pleasure in introducing Chris Fox, who is the Care Delivery and Payment Manager within the Professional Satisfaction and Practice Sustainability Group at the American Medical Association. In this capacity, Chris supports the AMA's multi-year journey identifying effective care delivery elements that help support high-quality patient care, physician satisfaction, and practice sustainability. He manages the development and implementation of tools and resources that assist physicians in the adoption of new commercial and governmental payment and care delivery models. Additionally, Chris works with external partners such as coalitions, commercial payers, employers, patients, healthcare systems, and hospitals, and electronic health record vendors in promoting new payment model concepts. Prior to joining the AMA, he worked at the Healthcare Reform and Innovation Administration within the District of Columbia's Department of Healthcare Finance, designing and implementing new, innovative health information technology programs. First, I'd like to introduce you as our speaker today and now hand over the platform as you explain the AMA's Payment Model Evaluator.
Thanks so much, Jen. I really appreciate the introduction and really appreciate being asked to give the presentation today. We're excited about the work that we've been doing in this space and being able to partner with physicians and practice managers and making sure that folks are ready and prepared for the MACRA QPP program now and moving forward. Before I do a deeper dive into the actual Payment Model Evaluator tool, I thought I would just provide at least some general comments about the MACRA QPP program, just to make sure everybody is kind of starting off on the same footing. So this is just a review of the AMA's current strategic focus areas. The AMA is focusing on improving health outcomes, professional satisfaction, and practice sustainability, as well as accelerating change in medical education. My specific group falls within that center focus area, particularly around the practice sustainability, which is what we're focusing on with today's webinar. Just some general comments around the MACRA QPP efforts. Really wanted to make sure, as folks I'm sure already are aware, that this initiative is very complex, in part because the healthcare system is complex, but also there were a lot of issues with the SCR legislation that needed to be resolved. But the focus really is that the QPP program and macro legislation at large is really meant not as just a replacement for the SCR legislation, but really getting the Medicare payment moving more in a direction of value-based care. So there are a lot of new requirements that are part of this program that are revisions from some previous more siloed system associated with the fee-for-service program within Medicare Part B. That includes value-based modifier, the PQRS program, et cetera, as well as meaningful use. And part of the goal of the macro legislation and subsequently the QPP rules was to simplify the administrative processes that physicians and the practices have to go through in order to meet some of the requirements around the purposes of those programs and really streamline that process moving forward. And, especially with some of the recent news coming out this week and what's been happening over the past several weeks around the repeal and replace of the ACA or Obamacare, want to make sure people understand that MACRA and ACA are different. While the healthcare system is tied in many different ways, the mechanisms for these programs are different and are not tied together. So the repeal and replace, while tertiarily may have some effects within the MACRA efforts, the actual legislation and rules moving forward are not affected with some of the conversations that are happening now, and I'm sure going to be happening over the next several months. And what the prior administration has communicated, and I'm sure the current administration will talk about as well, is making sure that folks know that this legislation and the subsequent rules were a starting place. It's not the end of the program. They will continue working and updating the rules as part of this program to make sure they're meeting the needs of physicians and their practices. So we expect to see additional clarifications and rules coming out in the subsequent months throughout the year that will hopefully make things even better as the program continues moving forward. So this slide just highlights some of the elements I just talked about, making sure to show where there's reorganization as part of the old SGR legislation as well as new opportunities within the MACRA legislation and subsequent rules. So as I mentioned, it is really a combination and streamlining of the PQRS meaningful use and value-based modifier programs, reducing burden, greater flexibility for physicians, etc. It also provides opportunity for folks to start getting involved with alternative payment models and really this broader transition to more value-based healthcare. And wanting to make sure that there's engagement from physicians as part of how they want to be involved with these models. There was the creation of the Physician Task Force, or PTAC, that is reviewing potential models so physicians can be really involved in the process of not just following the models, but also the creation of them, which is really important, at least from the AMA's perspective moving forward. And there's also the addition of a category called improvement activities that are really involved with helping practices improve the way that they provide care and have a higher quality interaction with their patients. So just a highlight for folks, I'm sure hopefully at least many of you have seen this in some capacity, but this is the timeline that was laid out as part of the macro legislation. The key here is that there is a glide path as part of this process. It will continually evolve in subsequent years, but really making sure to note that there's a fairly flat updates for the fee schedule, the fee-for-service fee schedule, which is a little bit different from what had been happening in the past. And really the hope from CMS is folks will then be engaged in MIPS or the advanced alternative payment models in terms of being able to have additional improvement on the payments they receive as part of their Medicare Part B work. This is just a highlight of some of the milestones that will be happening this year as well as subsequent years. This is subject to potentially change depending on any proposed and final rules that may be coming out this year for 2018 and beyond. But just wanted to make sure that folks have a general concept of how the year will go out, making sure that they have an awareness of not just what's happening here, but also starting to think about what's going to be coming down the pike in subsequent years. And this is really where at least our group within the AMA is focusing, is on helping physicians prepare for this program. You know, there's a lot involved with the QPP, and understand that physicians already have a lot on their plates. And so AMA really wants to make sure that physicians, practice managers, and anybody else involved with the practices know that we are committed to partnering with you all in this journey and developing resources and tools to alleviate some of the burdens and make sure the transition to this program is as smooth as possible, and continue being partners along that journey as the program continues to evolve. So as Jen and others have made mention, the AMA developed what we call the Payment Model Evaluator, or PME, which is a free tool that's hosted on our AMA website that allows physicians, practice managers, or others enter in data as part of their practice and start getting a better sense about where they fall in within the QPP program, and start thinking about next steps to prepare for collecting and then subsequently sending data to CMS to attest to the requirements as part of this program for the 2017 performance year. As a reminder, the performance year is 2017, with any potential payment adjustments would be applied in the 2019 practice year. And I will go through a deeper dive in terms of that tool in a few minutes. Also want to make mention of a checklist that the AMA has that just provides some broad questions that physicians and their practices really need to be thinking about as they prepare for this program. Technically, the program started January 1st of this year, and so, you know, physicians and practices in general really need to be starting to think about how they're going to fit in with this program, and these are some great questions to at least begin thinking about as folks prepare for the program, and that's hosted on our AMA website, specifically within our macro page. The AMA also has developed a set of, I think it's 43 leading up to going to get up to about 50 this year of specific modules that really help physicians and their practices think about the evolution to the practices and making sure that they're ready for these transitions that are happening with the healthcare environment. There's modules on how to select an EHR vendor, ways to think about and reduce physician burden. There's really a lot of great modules that are interactive for users to really be able to think about how to continue transforming their practice to better support their patient populations. And also want to note that, at least based on the prior administration, select modules within the Steps Forward system will be categorized as improvement activities, and physicians and practices will receive credit for completing those modules as part of that specific portion of the MIPS categories. We're still waiting for clarification from the new administration about which specific modules will be categorized as improvement activities, and we're hoping to get that clarification in the coming months. But there has been a lot going on in this space, so we, as everybody else, are waiting for that additional clarification, and we'll distribute information to folks that are interested once we are able to receive that from the new administration. And then lastly, as I mentioned, we have a great homepage on our AMA website that really talks to a lot of the tools and resources that are covered, in addition to some educational content for those folks that are still confused, and understandably so, about what the MACRA and QP programs are and what the requirements are for those systems. So with that, I am going to dive into a live demo of the PME tool, and hopefully folks are able to see my screen. Olivia or Jen, if for some reason there are issues, hopefully you all will let me know that folks won't be able to see anything or aren't able to see anything.
Hi, Chris. It's Olivia. We can see your screen fine.
Perfect. That is what I'd like to hear. Hopefully that continues. So what hopefully everybody should be seeing right now is the macro page that I mentioned at the last slide that has a lot of great information about macro, about the QPP program, and a lot of educational content, and is continually being updated as we receive clarification information from the current administration. But what I want to point out is that one way to get to the PME tool is through that page. It's prominently placed because we really want to make sure that that users have the ability to go through this assessment as they continue preparing and moving forward to implementing the 2017 performance year. So what's currently on the screen now is the landing page for the PME. It provides a high-level overview of what MACRA is, as well as some links to additional educational content, which I will just highlight briefly in a few minutes. But as you scroll down, it continues engaging the user in terms of what they really need to be thinking about as part of the MACRA program, and how that specifically is directed to them and their practices. This is a timeline that really starts from the beginning of this process to the replacement of the SGR legislation and when MACRA was passed, running through all the various different elements of the proposed rule, the final rule, and it shows where, based on the date today, where we are in that program, and as that continues moving forward through subsequent years. I will note that the AMA is continually evolving these tools and looking forward to feedback and looking at ways to making this timeline more specific, at least to the 2017 performance year, so physicians and their practices really get a better sense of what they need to be doing now to prepare for this 2017 performance year. So if you were a user and you really want to learn more about the educational content as part of MACRA, it is integrated within the PME assessment tool itself. But you can also go directly to the educational tools, which is what this tab is showing. It has just some general language about what value-based care is, some 101 information about MACRA and the specific requirements associated with MACRA, highlighting MIPS versus alternative APMs, etc. And then there's subsequent tabs that go through detailed information about MIPS and APMs, as well as some things to consider as users are thinking about implementing and what the next steps are that are associated with that process. I'm not going to highlight those too much at this webinar, but it is something that for those folks that are interested in what MACRA is and value-based care in general, these are great educational tools. So this is all users of the PME tool need to create an account within the AMA system. It really allows us to help track what's happening with the tool, but it also allows us to more directly interact with the users, both in this current iteration of the PME as well as in future iteration of the PME, and additional resources as part of our value-based care environment. So it's really pretty straightforward. Ask for a username, your name, email address, a password, and just a little bit information of who you are and where you come from. It shouldn't take more than 30 seconds to complete, but it really is helpful as part of the management of this tool and how we envision it evolving moving forward. So once a user creates an account or signs in, if they already have an account with the AMA, they will get into the actual PME assessment environment. What's showing on the screen currently is what the screen will look like for a user after they have completed the assessment. Just wanted to show kind of people what the end product looks like. You then have an assessment, shows the last time you completed it, and you can always update it based on new information or changes that happen within your program. You have the same educational tools that I highlighted previously that are accessible directly through the MACRA AMA website as well. And then the power of this tool is the creation of a profile specifically for your practice based on the assessment questions that have been answered. So I'm going to try to run through the assessment quickly so people can get a better sense of what the type of questions are that the PME assessment asks. So I'm going to go ahead and select retaking the assessment. Again, this is for folks that would either be submitting a new assessment or updating their assessment based on changes or anything else that would be happening within their practices. So I'm not going to go verbatim for everything that is happening in terms of the types of questions, but really it's asking, the role within your practice to get a better sense of, is this one of the physicians in the practice, or maybe it's one of the administrators that is helping a physician create this assessment for their practice. And then it starts diving into more specifics about the specialty involved with that practice or that group practice. So I'm going to start selecting a few choices just to allow us to get to a response at the end of the assessment. Now we're getting into specific details about whether I'm an individual practice or whether I'm answering these questions as part of a group practice, and that really gets to start gathering information, especially how you're considering attesting to the specific requirements for the QPP program if you plan to do that as a group or as an individual clinician. And the outcome of the assessment hopefully will be providing folks some additional information about how they need to be thinking about that. Again, start thinking about how the practice is set up. Are you an independent practice? Are you primary care focused? Are you in a rural health center? Maybe a FQHC? Those are things that will help provide more specificity for the assessment. And then this just gives a better sense of your practice size, and that will help really, again, create this more specific individualized profile for your specific practice needs. This next question is an important question because it is one of the exemption criteria for the QPP program. So if you are in your first year of participating in the Medicare program, then you are exempt from the 2017 performance year. Again, the same thing with this next question about whether you see more than 100 Medicare patients a year is another exempt criteria. And if you have less than that, you're also exempt from the program. And then lastly, the reimbursements that are associated with claims is another exemption criteria for the MIPS, for the QPP program. So I'm going to start filling in some information as part of this profile. Again, this is something specific to your practices. I'm not going to go through every single question, but wanting to make sure to give people a general sense of what's asked in there. So we're now starting to get specifics about if your practice is involved with any specific type of APM that will affect which category you might fall into. With regard to your practice, I'm actually going to select just so you can see this practice that I'm filling out as part of the current MSSP program. And if you select any of those APMs, you will then get some subsequent questions that ask more specific information about that program. Again, trying to create that more individualized profile. So I'm again going to enter in some information. It's asking me about revenue and how much of our practice revenue is driven by this specific APM versus our general revenue through other work streams. So I'm just going to start adding in some information so we can get to the end product. Again, it shows the completion, so we're almost done. It really doesn't take a lot of time to complete the assessment, which was intentional. We really wanted to make sure this was streamlined and easy to follow for users so we can really make sure that we're gathering relevant information for folks as we're trying to implement a program. Again, I'm just going to start clicking through. So some of this information so we can get through to the end, getting a better sense of whether you use EHR systems and whether you're meeting the current 2015 edition of the certification criteria, and whether you are also meeting the meaningful use stage 2 requirements. There's also the ability, knowing that some folks, while they're filling this out, may not know that at the time of completing the assessment, can always click I don't know and come back and update it as necessary. And this is getting a better sense of whether you're doing PQRS currently and whether you're using QCDRs as part of your participation about that program, and the GPRO reporting requirements associated with that. So I went through, filled out questions. As you can see, it only took me a few minutes to complete. You can review the questions here just to make sure that you remind yourself about what you responded with. And then the power really is getting to the profile. So what, based on those responses, where do I fit within the QPP program? Within the QPP program. Based on my responses, it said that I less than the 30,000 assessments that were involved, so it says that I don't fall, I'm exempt basically from the program. I actually want to go back a moment to the assessment so I can try to get it so it's showing some more specific information, so you can see what it might look like if you had a higher revenue stream as part of Medicare. So I'm going to do this really quickly. Apologize. I want to make sure that you all can see what different levels that the profile could show me and how specific they are. One more minute. Excellent. So again, we're going to go into the profile, and you can see based on my responses, it changed from being exempt to now being part of the MIPS alternative payment model, which is different from the advanced APMs. And now you can start getting into more specifics about your program. There's more information about what's required for ACI, improvement activities, and costs, and starts giving some more information about the financial impact of the responses that you provided. I will provide a caveat that these financial impact reports are based on approaches that CMS released publicly. So these aren't specifically driven analytics by AMA itself, but it really starts allows practices to start gathering that information and really thinking about what the potential financial impact is of the QPP program, as well as the advantages that you could have in terms of your participation as part of that program. So you can see based on the 4%, 5% to the 9%, where you might be able to get rewarded or potentially being as part of that program, and some of the burden criteria that's involved with being involved with the system. And then, from here you can start also thinking about what the implementation criteria would be and the things that you need to be thinking about as part of the next steps after you complete that assessment. So I'm going to stop there. I know I went a little bit over, but I want to make sure that there are opportunities for folks to have questions, and I apologize if I went through things a little bit quickly, but hopefully everybody got a better sense of the power of this assessment and how it can be moved moving forward as people start thinking about how they're going to participate in the macro QPP system.
Thanks, Chris. It's Olivia. That was a fantastic overview. We'll take some questions at this time. If you'd like to ask a question over the phone, you can press #6 to unmute your line, or you can pose a question in the chat box. Just make sure that you're sending it to all participants. So go ahead and ask your question.
Chris, while we're waiting for those questions to come in, I just wanted to remind everybody that you can also access the PME on our New England QIN-QIO website, and we have permission from AMA to host this PME. And additionally, I'm really excited to hear that the Step Forward modules will be approved for improvement activities. It's a great program, and I encourage practices to use it. So that's really great news.
Yeah, we were excited about that as well, and really looking forward to getting some of the clarification information from CMS. Again, just to make sure we're emphasizing that that was the position of the previous administration, and we're at least what we know right now, we're thinking that that will continue moving forward, but we're still waiting for clarification from the new administration in terms of how that will work and whether those modules will be confirmed as being part of the improvement activities category. So just to make sure folks have some clarity there. And it's free and extremely helpful and engaging, and really emphasize folks taking a look at those modules. They're fantastic.
Olivia, do we have any questions at this time?
Jen, it doesn't look like we have any questions in the chat box at the moment. Again, please feel free to... Oh, yes, please, go for it.
Sure. My name is Dr. Yana Gustavo. I'm an otolaryngologist in Connecticut. And Chris, I appreciate the presentation. It was excellent. I had sort of a two-sided question about the budget neutrality portion of this whole system, which I personally still find egregious and a bit insulting to the docs. In that, 50% of them seem, roughly half of them are going to be dinged, as you said, or given a negative impact. So I guess the two-sided question is, one, is there any discussion at all, about that aspect of why, I understand the budget neutral part, but, why go after potentially really good docs? And number two, I see that your calculator here seems to help, to me, the black box is how do you measure the quality of a given physician to determine are they high quality or the lower quality piece. And it looks like the tool helps us to get there. Could you maybe just highlight what maybe are the more critical measures that are being used to evaluate our quality?
So I'll take the last one first, and then I'll see how I can respond to the first one. But so the quality measures are really specific to how physicians are practicing. There's the goal from CMS to provide as many options as possible to a number of different specialty practices in order to be able to have them specific to the way that they practice medicine. There are six criteria or six quality measures that physicians need to complete as part of that category. They do have a tool on their website that starts allowing physicians to start combing through those measures and saying what applies best to them. The AMA is also looking at engaging those types of tools and the evolution of this product to start getting folks to think about not just what quality measures apply to them, but how that then affects their scoring and how that allows them to submit them to CMS as part of the process that physicians and practices have to go through throughout this performance year. So it's hard to really say which specific measures are best for your specific practice. But the intent in general from CMS is to provide a list of measures, and I can't remember it off the top of my head how many measures there are currently, but the goal is to allow physicians to have the flexibility there. And again, the AMA is looking to evolve that process moving forward to engage physicians in terms of that thought.
So I understand, sorry.
Please, go ahead.
I was just going to say, I understand the quality measures. I understand you have to have at least one outcome measure. And I have been, working very diligently and a little bit with difficulty finding appropriate measures. But I guess that was the heart of the question is right now a lot of our grading based on how we perform on our selected at this point 6 measures.
So
I guess it was other features or other aspects.
Yeah, so as part of and it was as part of another deck that we have, but the quality for the 2017 year is 60% of your total MIPS score, if that is the track that you are on within the 2017 performance year. There are 3 different options within the performance year in terms of pick your pace and a few others that you do not have to submit all 6 measures if that's something that your practice so chooses. It is, something that you should at least be submitting something within this year to not get dinged in terms of the negative payment for 2019. But the assessment really is gathering information about your practice and seeing is there opportunity to gain more than just the one measure, the pick your pace option, which is kind of the bare minimum. Are there opportunities that the practice can really improve on the payments that they're receiving through CMS by submitting more than just that minimum criteria that CMS is asking?
If I may jump in for just one moment, I wanted to ask the doctor, are you familiar with the specialty measure set for otolaryngology?
I am totally familiar. I've looked at the site. Unfortunately for the outcomes, the one I believe that was suggested was SSIs, post-op surgical site infections. And I think it was thanks to you guys, to our Connecticut State Medical Society contact, discovered that it's not quite so simple as just picking an outcome measure, but that there's levels of points that you can attain for each. And the SSI, unfortunately, was a very low qualifier. I think it was around 3 was the maximum. So, that's what I was sort of referring to is I'm hunting, looking for other parameters, but yes, I'm familiar with what you just discussed.
Okay. Well, I'd like to thank you for your question, and if possible, we will have someone contact you and reach out to you to offer additional support if you're interested. And are there any other questions at this time?
Yes, Jen, it's Olivia. There's a couple questions in chat. The first question is from Suzanne. At this point, do certified nurse midwives need to plan to participate in this program in 2017 or assume they will not need to report until 2019?
I do not believe that they fall into the categories of folks that have to, that fall into the category within the 2017 performance year.
Okay, thanks, Chris. And then another question from Christine. There are a number of methods of reporting, EHR, registry, etc. Can a practice report via multiple methods to achieve complete reporting? If so, how does that, I have to scroll down, get counted by CMS?
Sure. So I think that it's a tough question. I know this is part of the thought process that providers need to go through. And something that we are continuing thinking about in terms of helping folks make that decision. I would refer folks to our website and our decks that are associated with that website that provide some additional information with regards to that specific question.
I can speak to that question a little bit more, Chris, if I may. You are able to report different methods, but just not within the category. So, for example, if you're choosing 6 quality measures, those 6 quality measures need to be reported with one method, for example, through your EHR. But if you're interested in a testing for advancing care information, which is your former meaningful use category, you can attest through the CMS portal when that's available. Hope that clarifies it.
And I will say, too, that if you are choosing to attest as a group for one, you need to do it for group for all. You can't do it as an individual for ACI and then a group for improvement activities. It has to be consistent across the board.
Thanks, Chris. I thought before I may have heard someone who was trying to ask a question over the phone. Was there anyone else who would like to ask a question? You can press #6 to unmute your line. I guess not, and I do not see any more questions in the chat box. Chris or Jen, is there anything else that you guys would like to add before we wrap up today?
Yeah, I'd just like to thank you all again for having us. It's really important to engage the physician community as part of this process, and as I mentioned during my presentation, that the AMA is continuing creating new resources or involving our resources and tools to better supply physicians and their practices with how to think about preparing for this 2017 performance year and what they need to do, and always would love feedback from folks both on how the PME currently functions, as well as anything that physicians would like to see that they don't currently have that would help them in terms of their decision processes. So look forward to engaging with folks as we continue evolving these tools moving forward.
And Chris, I just want to thank you for your time, and we appreciate partnering with the American Medical Association to disseminate this important information.
Thanks again, Chris and Jen. I just have a few last-minute announcements before we end today. We are now on social media, so please connect with us on Facebook or LinkedIn for the latest resources, webinars, and other offerings from the New England QIN-QIO. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the eval right now, or you're currently sharing this computer with someone else, you'll receive an email tomorrow with the link to the evaluation as well as the link to the event page on our website. The PowerPoint is already posted on our website, and it was in your Day of Details email if you did register for this webinar. And within the next few business days, a recording and a transcript will also be added of the webinar. Thanks again for attending. Thank you very much to Chris and Jen, and I hope everyone has a great day. Thanks.
The reader has disconnected. The conference will be terminated in 5 minutes.